Now, tuberculosis is the fourth leading cause of death in Kenya, with over 100,000 Kenyans currently on treatment for the disease. But although the disease is largely treatable, the government is now raising concern, that new strains of drug-resistant TB are circulating and pushing the death toll up. Margaret Kimathi reports on why this is worrying.
Meru County. Located in the eastern part of Kenya, Meru is one of the country's most populous counties with 1.5 million people, but it also happens to carry the second highest burden of tuberculosis in Kenya after Nairobi County. From a distance, Mary Gasheri looks healthy and fine, but she's a multi-drug-resistant tuberculosis patient. The 32-year-old mother of two has been battling multi-drug-resistant TB for 3 months now. Gasheri first experienced symptoms of TB early this year.
Mwezi wa 3 mwaka huu ndio nilisikia nikiwa na hiyo shida. Nasikia mwili wangu una afya. Kulala nilishindwa. Mchana ndio nikakaa nikiwa nasikia usingizi. Kazi ngumu nikashindwa kufanya. Sasa kutoka hapo nikashindwa na kazi yeyote, sikuwa nakaa huku. Ndiko hiyo shida inatokea nikiwa huko Timao.
Gasheri was not aware that those symptoms she was experiencing were actually of TB. Therefore, she sought over-the-counter medication for 4 months. She finally went to hospital when those symptoms failed to go away.
Nikapimwa, nikaendelea sasa, nikapewa ndawa, nikaendelea nayo kukunywa. Na wakati nakunywa hiyo ndawa sikusikia mwili wangu ukipona. Naendelea vile vile tu. Nilikuwa na kilo 65 na sasa niko na 54, 53.
Gasheri, who lost her elder brother to TB last year, says that her recovery journey has not been easy as she faces stigma even from family members.
Niambianga kama nilikunywa mandawa nilisindo na hiyo ugonjwa umekataa kupona, hiyo kifua ilikataa kupona, niende kwa wanganga. Niende niangaliliwe nionekane nini inanikula.
Gasheri tells us that her older brother is also a TB patient and that her mother had contracted TB some years back. Her family has now been nicknamed a cursed family.
Kuna a lot of stigma. Kuna wale hawatajitoa waseme mimi nakooa kwa sababu hapa Meru, especially this area of Tigania, wanajua TB is a curse na it is associated with HIV.
This is the facility where Gasheri was diagnosed with multi-drug-resistant TB and where she normally gets her medication. Mikindori Sub-County Hospital serves an area reporting the highest cases of multi-drug-resistant TB in Meru County. This year, the facility has recorded 7 multi-drug-resistant TB cases.
In fact, we have a lot of fears because of the rising cases of the resistant TB cases, because everybody is at risk.
Multi-drug-resistant TB is the most dangerous type of TB as it does not respond to medication. This means that the drug can no longer kill the TB bacteria.
Drug-resistant tuberculosis is a form of tuberculosis where the TB germ becomes resistant to the medicines that we use for treating tuberculosis. And we have various forms of drug-resistant tuberculosis. I'm sure most of us have heard about MDR. So that is based on, so the type of DRTB depends on the drugs that the bug or the TB germ is resistant to.
Drug-resistant tuberculosis, especially multi-drug-resistant TB, remains a major obstacle in the task of putting an end to the global TB epidemic.
One of the main challenges we have with regards to the management of resistant TB is that the pipeline for development of new drugs is very slow. Unlike other conditions where you have every year there's a new drug, in the TB world that does not happen as fast, considering that this is a problem we have had for millennia.
According to the Ministry of Health TB annual report, Meru recorded a total of 4,160 TB cases in 2019. In 2020, the country recorded 3,651 TB cases, and in 2021, it recorded 3,815 cases. The leading local sub-county in terms of infections is Igembe South, followed by Imenti North and Imenti South.
with the capacity we are having, we are able to pick the cases at the lab. Yes, so we also need to move to the community and see whether we can put even, and also to scale the activities there so that we can reduce the cases.
Simon makes his 10th visit to Mekindori Sub-County Hospital in Tigania East. He's being treated for tuberculosis in this facility for the last 4 months. Simon had lost 28 kilograms from the first time he was diagnosed with TB, but upon taking medicine, his health has improved.
Nilianza kusikia mwezi wa 7, nikakaa hiyo mwezi wa 8, nikaendelea tena. Sasa mwezi wa 9 ndio niliondwa ugonjwa kwa mwili. Sasa saa hii sisikii vile nilikuwa nasikia. Mwili sasa umepata nguvu na hata kilo nimeongeza.
It is a tedious everyday visit by Simon, Gasheri and other patients, but one that they acknowledge is important towards their recovery.
Madaktari hapa kwetu wanaokuwa sana juu, hata wakiona ukiwa mgonjwa wanaendanga na family, wakiona wewe ni mgonjwa wanakuchukua, hata ukikataa kunywa dawa wanakuchukua, kuna mahali wanakupeleka, wanahakikisha unatumia zile dawa mpaka within unakuwa mzuri.
Mekindori Sub-County Hospital has been conducting mass TB screening to identify infected persons who are at high risk of disease. In July, the Ministry of Health National TB, in collaboration with Center for Health Solutions Kenya, launched the Introducing New Tools project to roll out the latest innovations in diagnostics, treatment and digital health technologies to strengthen TB care in Kenya. Mekindori Sub-County Hospital is one of the beneficiaries, where the hospital received a new diagnostic machine. September 2022, 192 patients had been tested, with 41 testing positive for TB and 1 drug resistance case reported.
And one advantage of this machine, it can detect even the resistance, ribavirin resistant.
Here we partner with the county government of Meru, especially the Department of Health, to ensure that we eradicate tuberculosis in the county, as tuberculosis is a big issue in this county of Meru, being the second highest burden for TB in Kenya.
Health experts are now calling upon Kenyans who are not yet infected with TB to take precautions, while urging those with symptoms to seek treatment immediately. Margaret Kimathi, NTV.